My name is Dr. Joe Dusseldorp and I'm a specialist plastic surgeon and a member of the Royal Australasian College of Surgeons. And my specialty area of interest is in ear reconstruction. And part of ear reconstruction is also otoplasty, which is the operation for changing the shape or the size of a normal ear. And normal is a word that some people don't identify with, but in reality, there are some social norms. We expect to see ears that don't stick out too much. Parents will often come to surgeons like myself and ask about procedures for trying to pin back ears or make ears less conspicuous. Otoplasty is one word that speaks to a number of different procedures that can relate to not just how far the ear sticks out, but its overall shape, how aesthetic it is, how big the earlobes are. There's a number of different elements that can make an ear fade into the background, much like the frame, of an artwork. And so I think it's important to understand what it is about the ears that make them look asymmetrical or make them look too obvious, and then to really think about how challenging it is to reconstruct that or to make that less obvious. It is a cosmetic procedure. There's no functional benefit from an otoplasty, but there is a Medicare item number for this procedure for children. It's something which can be performed roughly from the age of about 7. Anytime after that, it's possible to do an otoplasty procedure. It's something that I think every plastic surgeon has on the list of procedures that they like to perform. I think there are cases where you're better off seeing a specialist who just does this type of procedure, even if they're a specialist plastic surgeon, because there can be elements of ear reconstruction that may be more complex than just a simple pinning of the ears. And that can be to change the shape, change the cartilage structure, and also to try to improve the overall aesthetic appearance of both ears. The otoplasty procedure is a relatively straightforward procedure to recover from. We make an incision behind the ear. I don't make any incisions on the front of the ear. So the scars can be concealed in the fold behind the ear, and most patients will never see those scars. In fact, even I go back looking and find it hard to see them. It is a well-concealed scar. The recovery for that, however, we require a headband to be worn at night for 3 months. After the first dressing change at about a week, there's nothing that needs to be worn on the ears after that. So children don't need to be worried about going to school or being teased for having some obvious kind of headdress on anymore. I would say that the recovery can be slightly painful. There can be some bleeding and oozing, but most of this resolves within about a week after the surgery. There are some risks of the procedure as well, and so it's important to understand that whenever we're changing the shape of an ear, it is a cartilage structure that wants to go back to its original shape. We use nowadays more of a suture technique to try to hold the ear back into its regular shape, but this can relapse. The cartilage can break through those stitches, or if the headband is not worn at night, the ear can flick forward and some of those sutures may need to be replaced. There is a revision rate for this kind of surgery, and patients need to be aware of that before they proceed, that it may need to be redone. But generally, the complication rates are very small, and simply a reoperation is something that would be the most serious complication. Obviously, bleeding and infection are generic complications of any surgery, and all surgeries carry risks. The procedure is done as a day surgery, which means there's no need for an overnight stay, but it is a general anaesthetic procedure, so you would need someone to drop you off or pick you up. And most commonly this procedure is performed in children, but it can also be performed in adults, in which case it's a similar approach. Some clinics may offer to do what's called a non-surgical otoplasty or a incisionless otoplasty, and I would counsel people perhaps to consider exactly what that means. Certainly it is possible to put a suture in through the back of the ear and try to tie a knot and to pull the ear back, but this won't lead to a long-lasting result, and I've seen a number of cases where this can lead to infections and prolonged scarring and issues that haven't resolved the patient's initial desire. So just be careful about looking for procedures like that which aren't necessarily endorsed by societies such as this.